The first test item cluster is for mechanical neck pain that would benefit from thoracic spine manipulations. For the first item, you would want their symptom onset to be less than 30 days, their FABQ score would be less than 12, looking up would not reproduce their symptoms, and they would have less than 30 degrees of extension. They would have no symptoms distal to their shoulder, and they would have a reduced kyphosis of their thoracic spine or a flattened back. The next test item cluster is for mechanical neck pain that would benefit from cervical spine manipulations. The first thing is that symptom onset would be less than 38 days. The patient believes that cervical manipulations will benefit them. They would have greater than a 10-degree side-to-side difference with cervical rotation, and they would have pain with PA testing. Could I have you lay down on your stomach for me? They would have hypomobility and pain with PA testing. The next test item cluster is for a full thickness rotator cuff tear. The first item is a painful arc. I would have the patient raise their arms like this, and if that caused reproduction of their symptoms or pain, that would be a positive test. Next is I would ask them to slowly and controlled lower the arms, and if they could not do this, or if one arm dropped before the other, that would be a positive drop arm sign. Next is the infraspinatus test. I will have the patient flex here at the elbow at 90. I will ask them to resist me as I apply a pressure in. If the patient deviates inward or it causes reproduction of their symptoms or pain, that is a positive infraspinatus test. Next is the test item cluster for subacromial impingement syndrome. We've already seen two of the tests, the painful arc and also the infraspinatus test. Those would both be positive in this test cluster. The next item is the Hawkins-Kennedy test. I would have the patient go into this position, and I would ask them to resist me as I apply a downward force. And if that caused a reproduction of their symptoms and pain, that would be a positive Hawkins-Kennedy test. Next is the test item cluster for cervical radiculopathy. The first criterion is a positive Sperling's test. Would you extend for me? Next is a positive distraction test. And next, they would also have less than 60 degrees rotating towards the side of their symptoms. Next is a positive upper limb tension test A for the median nerve. A positive upper limb tension test would be that if it reproduced her symptoms, if that side bending her ear towards the side alleviated pain, and side bending away worsened the pain, or elbow extension differences of greater than 10 degrees bilaterally. Now I'm going to demonstrate the O'Brien's active compression test. Can I have you raise your arms out for me and place your thumbs downward? Now I'm going to apply a downward force distally and resist me. And now can I have you bring your thumbs straight up? Same distal force. I would ask her if she felt the pain worse with thumbs down. That would make this test positive. And I would ask her if she felt the pain superficial or deep. Next, I'm going to demonstrate the sharp purser test. I stabilize here at C2. I ask the patient to flex forward a little bit, and I apply a posterior force. And there's sharp purser. Next, I'm going to demonstrate the cervical flexion rotation test. To start, I'm just going to simply rotate her to each side. And now to start the test, I'm going to fully flex her and then rotate, expecting half of the motion that I had without her being flexed. Next, I'm going to demonstrate the biceps load 2 test. All right, can you push against me? Pull your hand towards your face. Awesome. Relax. Is that all I need? Now I'm going to demonstrate an upper limb tension test for the median nerve. The upper limb tension test is positive if this recreates her symptoms, if it's worse when she side bends away, if it's better when she side bends toward, and if there's a greater than 10-degree elbow extension difference bilaterally. Discuss the difference between a rotator cuff tear and a C6 radiculopathy. For example, if there was a supraspinatus tear, you would have isolated pain on the supraspinatus fossa and in the actions of the supraspinatus, which would be external rotation and abduction. You would also have all three tests in the test item cluster for a rotator cuff tear would be positive, including the painful arc, the drop arm, and the infraspinatus test. For a C6 radiculopathy, you would have diffuse weakness in all the muscles that are innervated by nerves with components from the C6. That would include biceps brachii, triceps brachii, brachioradialis, and many others. For C6 radiculopathy, you would also have decreased sensation to the lateral forearm and the lateral hand and fingers. You would also have a decreased reflex of C6, which is right on your brachioradialis muscle belly.